Oh, we have a live one tonight. I love it. All right. I feel like taking my hair down now with you, Dr. Corwin. Okay, so congratulations on this honor. I'm sitting next to your colleague. She speaks so highly of you, and I could see why. You are a dedicated professional, and you've saved a lot of lives. One thing she said, you had a decisive response to the pandemic. Explain what that was.
Look, we all love New York. And New York was in big trouble. And so many people in this room saved our city. And I'm very proud of that. We didn't have PPE. We couldn't test effectively. 25% of the patients coming into the hospitals died. We had our finance people working in morgues. We had coolers outside the hospitals with loved ones who were deceased. We were FaceTiming families from our ICUs because they couldn't come in and see their loved one die. And we made it through. And despite the fact that the president said we had PPE falling off the back of trucks, and despite the fact that everyone said they couldn't believe that we were using 100,000 masks a day, we got through it. And I'm really proud of that. And I'm proud of the fact that in the aftermath of COVID, we really paid attention to those issues of social justice and the inequities that we see around us and tried to resolve that. So I think, that's what I see is that New York responded, and I'm happy to be part of that response.
Yeah, and we're proud of you for what you did. We're proud of you. Dr. Corwin, were there times during that crisis when you had to take matters into your own hands and just figure things out on your own due to the lack of guidance from the federal government? I'm sorry, they shouldn't have put me up here.
Well, I'll tell you this. There were some nights when I would say to my wife, Ellen, I'm not sure we're going to make it through tomorrow. When we learned that there was no federal stockpile of PPE, when we learned that the federal stockpile of ventilators were a bunch of broken down old ventilators, and we had some of our staff going to New Jersey to a plastics manufacturer to manufacture tubes that would fit into the ventilators. Wow. So it was pretty bad. I think that I don't think people really believed how horrific it was in New York, but New Yorkers believed it. And I think that we pulled together. What I said to our team about a week into it was, cavalry's not coming over the hill. It's on us, and we're going to have to do it, and we're going to have to pull together and do it ourselves, and they did. So it's great to say that I was decisive, but we had 35,000 people saying we're not going to fail, and that really was, I'm very proud of that.
Wow, so I'm proud of you too. I'm proud of you too. Okay, so let's get back on script. I know they're like, what is she doing? What is she saying? Welcome back to NIAM. As a longtime NIAM partner and supporter and former trustee, we know you're happy to be back in this historic institution. Did you study here as a med student?
I didn't. I went to Northwestern, but I came back here to train. But NIAM is part of the fabric of this city and part of the social fabric of the city. And it's astonishing to me in 2024 that we're still having a debate around DEI.
Right.
When did diversity become a bad word?
Thank you.
When is equity not something that's desirable? And when is inclusiveness in our society not a desirable goal? How did that get turned around?
All right. Thank you. Thank you.
So
it's been to your point. I'm so glad. Now you brought us here, so we're going to dig into this a little. Let's dig into this a little bit. Diversity, equity, and inclusion has been demonized to the detriment of our beautiful mosaic called America. And explain to us how the demonization of DEI is affecting healthcare.
Well, I think it affects all the things that NIAM does with us. We do community needs health assessments to determine what the needs of underserved communities are. We have to accept the fact that there has been structural racism in this country that has delivered poor health results. You know, you talk about black maternal mortality and morbidity. That didn't happen out of the blue.
That's right.
So I think that this denial that there have been inequities in our society is highly problematic. And when you say, well, diversity means you're going to choose unqualified candidates, take a look at, you know, my management team. They are the most highly skilled people in the world.
Yes. Exhibit A. Exhibit A. Yeah.
And, you know, I'm going to give a plug to a former colleague. You know, Steve Safer is here. And Steve is the former head of Montefiore.
Stand up.
Steve, stand up.
Good to see you, Steve. Good to see you.
When you talk about contributions to this city, think about what the Bronx would look like without Montefiore.
Right. That's
And what Steve did in Montefiore. So
yeah, great
I'm
point.
sorry,
Good.
I'll
we're
stop.
having a good time. I'm enjoying talking to you, okay? Let's let our hair down. It's almost over, right? So, Doctor...
I'm good.
So, talk to us about the Dalio Center. There's something magical happening there when it comes to breaking down barriers in healthcare.
Look, Julia is one of the great leaders that I've known, and she's done a fabulous job with that center. So it was great that I asked Ray Dalio for $50 million, and he gave it to us, but she's made the whole thing work. You take a look at the sickle cell awareness program that she developed, and you take a look at providing comprehensive care to sickle cell patients. Look at the disparities between monies going into sickle cell research versus cystic fibrosis. And so care for sickle cell patients has been fragmented. Sickle cell patients get demonized because many of them get addicted to opioids because of frequent pain crises. The care is not comprehensive. And we've tried to address that. Julia's tried to address that and addressed algorithmic bias in healthcare, addressed making sure that we're collecting social determinants of health information on everybody. You know, when she first started the Dalio Center, we didn't collect race and ethnicity information on 40% of our patients. Why? Because they opted out. Why? Because I'm sure many people were afraid to give their race and ethnicity information because they figured, well, they're gonna treat me badly. That's now over 90%, or well over 90%. And when you get race and ethnicity information on people, then you can start making correlations to, okay, are outcomes different in the hospital? Are outcomes different after the hospital? Can we get genomic information on people of all ethnicities as opposed to mainly white people? And can you have insights to that genomic information? All of that depends on this type of work, and she's done a phenomenal job with it, and I really applaud her, because it's not me that's done the work, it's her.
Absolutely. So what kind of progress have we made in getting that information? Because you well know most of the standards are with white males. It doesn't work for a black male with hypertension if the standard was based on a white male with hypertension. That's rampant throughout our healthcare system.
Yes, it is. Well, if you look at what we've done with algorithmic bias, why did black patients not get renal transplants? Because the algorithm for creatinine clearance was skewed against black people.
Exactly.
I don't know if anybody had malice aforethought, but that was the case.
Right.
Why did black people not get lung transplants? Well, they didn't get lung transplants because lung capacity was measured right after the Civil War.
That's correct.
And many black formerly enslaved people had low lung capacities because they were malnourished. So that's why, you know, so you go through all of these things around algorithmic bias, and unless you look for it, you don't find it.
You don't even know it's there because it stretches back so long.
Right.
Right? So it's time to update everything.
Yes.
Is that happening at the Dalio Center?
Oh, yeah.
Yeah,
It's
explain
happening
how,
in our
explain
hospital.
how.
Yeah, well, you eliminate the algorithm. You know, that's...
And you're rebuilding the algorithm.
You rebuild the algorithm. This is, we had black nurse practitioners in our liver transplant program who helped us change some of the algorithms around liver transplantation. If you liberate people to tell you what's actually going on, and you actually have an inclusive environment, and you believe in respect and inclusion and belonging, then you start to move the ball forward. And NIAM is really important in that because it's about healthy communities. It's about identifying communities. We could not have done our community needs assessment throughout the city if we didn't have NIAM's help. So these things work together, and it's really important for us.
So how do you deal with resistance from professionals in your field that want to leave things the way they are? Because not everyone is on board. And you know that, right?
You know, what I think most, if not all, healthcare practitioners go in wanting to do the right thing.
Okay.
And I think that if you give them a rationale for why something is right, they'll buy it. And then you have to marginalize the people who are resistant to it if the vast majority of people understand that we're doing something that's important. Look, I get criticized sometimes because people think that my views of diversity or inclusion or social inequities is to the left of where their views are.
Right.
I also get criticized from people who are to the left of where I am.
Right.
I mean, my wife is to the left of Trotsky, so, I mean, so... So,
That's great. That's great. You know, our former health commissioner, Dr. Chosky.
he did a great job during COVID.
He did an excellent job during COVID. Would you stand and be recognized, our former health commissioner? Okay, he's at table 15. He doesn't want to stand.
He really did. Look,
he did.
This was tough.
Yeah, no, it was, and unprecedented.
Tough and unprecedented, and you know, we're dealing with the state, we're dealing with the governor, we're dealing with the mayor. You know, I recall the discussion that we all had: should we close the schools? And you know, everyone says there was a lot of learning loss. Maybe we shouldn't have done it. Maybe the retrospectoscope is always correct. Yeah. But I don't know what would have happened if we didn't close the schools. Right. I really don't know, because the city was at the breaking point. If it hadn't peaked in the middle of April of 2020, we were down to our last two. We were down to our last 2 ICU beds. We had gone from 450 ICU beds to 900 ICU beds, and we were down to 2 left. We were down to 2 ventilators being left. So you know, we were that close. That close.
Wow. But he did a phenomenal job, absolutely. And he gave me a great suggestion for a question.
Which was?
Which is, he said, talk about the difference between health equity and health care equity. He said, people conflate the two. They're not the same thing.
Well, I think there's a difference between health care equity, and health justice.
Ooh.
And I think that, and Julia taught me that. She'd given me the vernacular. But her explanation is the right explanation.
That's good.
If you believe in social justice, then you have to believe in health justice. And there is an element of justice here. It's not just that you're treating people equally. Is the care just, and have you delivered justice to populations that have not been given that in the past? And some people object to those terms and object to the term social justice, but it's there. And when you look at some of the healthcare issues that we're confronting in 2024, whether it's reproductive rights or all the issues associated with things, you know, you talk about how do you deliver health equity? Well, if you cut SNAP funding or WIC funding, you're not delivering health equity. And so I think that these issues are really fundamental as we get to this election, if we're really serious about trying to say we believe in health equity and believe in health justice.
Yeah, that's a great answer. Share how the Dalio Center's initiatives have helped shape New York Presbyterian's clinical strategies, and how the responsible use of patient socioeconomic data is not only a moral imperative, but also a sustainable approach to healthcare delivery.
Well, I'm going to credit Steve Safer for this one, because he said to me, how could you, you take care of a heart failure patient, and this is a true story. He said, Steve, you take care of a heart failure patient, and you've now going to discharge them from the hospital. And it's the middle of the summer, and they live in a 5th floor walk-up without an air conditioner. How's that going to work out? And so I think that it's that if you don't understand housing insecurity, food insecurity. Julia just did you talked about the session that NIAM did on environmental issues. Environmental justice is really critical. Climate change becomes critical. You look at the asthma rate in the South Bronx, all of those things. So I think that if you don't have that context, and look, I think that in my medical career, I was probably relatively late to the game. You you stayed in your swim lane. You took care of the acute patient and then they went home. I think that healthcare organizations need to enlarge their swim lanes. We need to have tight connections with community-based organizations, tight connections with organizations like NIAM or the Citizens Committee for Children, so that we actually can provide a healthier New York. And NIAM has always been committed to a healthier future for New Yorkers.
Yeah, more than most in this room are uniquely aware of the federal requirements to conduct community needs health assessments and to develop community service plans. And talk to us about how you're impressed with NIAM's leadership in this regard.
Well, they do a great job of partnering with us to develop that. But, you know, you can develop a plan and then you put it on the shelf. The proof is in the pudding. Do you develop a plan and then follow up on the plan? So when we went into Brooklyn and Queens, we have a very mature set of community services in Washington Heights and Inwood. But when we took over Methodist Hospital in Brooklyn and the New York Presbyterian Queens, we're much less developed in those areas. And you got to think, you know, Brooklyn's got 2.6 million people. And so we have to enlarge our footprint in Brooklyn and Queens, which has 2.3 million people. Not all, I know that the New Yorker cartoon thinks that everything is centered in Manhattan,
Right.
but you know, this is a very large city, and we got to take care of everybody in the city.
There are 5 boroughs.
That's
right,
correct.
Right. We are forbidden on New York 1 from saying outer borough.
That's right.
That's a dirty word at New York 1, yeah. So lastly, what are you most proud of? The Dalio Center was born out of the pandemic, right? So what are you most proud of?
I'm proud of the culture we have at New York Presbyterian. I'm proud of the people that work there and their commitment to the mission of our institution. And that mission is we take care of everybody the same way, and that we exist for the public good. And I know people think of us as a rich institution, and we've been fortunate to have a fairly large endowment, a lot of philanthropy, but the reality is if you don't use the endowment, the philanthropy, the surplus that you create to create better lives for all of the New Yorkers, then we're not doing the right thing. And I really believe that our culture is a strong one and really emphasizes that. And quite frankly, I think that if anybody tried to take the institution over and switch that in terms of what are we trying to do, I think they'd have a revolt on their hands. I think people really feel committed to that.
That is awesome. And do you feel that the Dalio Center could one day become a national model?
Well, I think that we want to show people that the Dalio Center scales. And I think what Julia and her team are trying to do is to show that there is a quote-unquote return on that investment, that this is something that can be replicated. This won't work if it's just, hey, we did it and no one else can do it, right? It's got to be that there's a national network, that people really feel that this is scalable and that it works and that it improves lives. So, you know, I really feel strongly about that.
Well, it was an absolute pleasure having you here, I must say. And you are changing lives, you and your team. Congratulations on your award, well deserved.
Thank you very much.
And I want to say, I think I should have him and Julia on my show, don't you? I think the whole city needs to know about the pioneering work at the Dalio Center. So hopefully we can make that happen. It's a pleasure. Thank you.
Thank you all.